Doctor, the other question is like, what role does diet play in Ayurveda and how it can be tailored to address specific concerns, especially those related to hormonal imbalance?
See, diet plays a very, very important role because, as I said, that when Charak has mentioned herbs that are useful in a certain conditions, below that, Ahar, Vihar, and Achar have been mentioned as well. So it definitely plays 80% role in treating. It can act as a medicine if you use it right. So when it comes to hormonal things, so I would say that these are tags: PCOS diet, hormonal diet, menopause diet. So basically, anything that nourishes your body is good for your hormones. I would never recommend to fall into the trap of these tags. Always work on eating good. If I say, okay, what is good for hormones? Eating dry fruits, that's a dietary fat. Eating dry fruits every day. Don't ignore seeds. That's again omega fatty acids. So seeds, it's not that it is only good for hormonal health. If you will see that it is good for people who have high cholesterol as well, right? Who have constipation as well. Because there's a seed oil which lubricates the intestines. And then when it comes to have a 200, 300 grams of vegetables every day. So vegetables, they have fiber. Basically, that is also going to work on your digestion. So PCOS women, normally there is a lot of digestion disturbances in PCOS women. So we say, so when we are calling it as a PCOS diet, the other whole population is ruled out, or hormonal diet, the other population is ruled out. So there are practices which we say that balance hormone, but they are actually good for overall health. So when we say that, you should go to bed by around 10:30, 11, definitely it balances your hormones. But can I say that it is not mandatory to go on bed for the people who are not, who are not females, or for men? It's not like that, right? So we all have changes going inside our body. We should work with the rhythm of the nature. So yes, when I say diet plays an important role in hormonal health, but there is no so-called hormonal diet. So follow everything that is sattvic, that is recommended for your body, that nourishes your body and that nourishes your soul.
Awesome. All right. So, as a lifelong learner, how do you stay updated on Ayurvedic practices, and what role does continuous education play in your approach to a holistic well-being?
So when we say updates in Ayurveda, honestly, there are no updates. Like in allopathy, there is a medicine which is launched and after 10 years it is banned because of its side effects. In Ayurveda, what was said and explained thousands of years ago is true in today's term. So I always revisit Charak Sahita if I want, because every time there is a different takeaway from that Granth. So I revisit it there, and that's my way to stay updated in the processes. Yes, there are NCBI studies. So, to prove that, okay, what Charak said was right, and to see the results of the cross combination on our own patients. So, we do some in clinical studies. Many doctors do those studies and they get published in journals and NCBI. So, those studies, they are the evidence that yes, this medicine or this combination is still working fine. So I refer to NCBI if I want evidence-based solution, and Charak Samhita is my go-to book for Ayurveda.